Hello, this is C.ROSENDAHL, Red and Pink Lesions, Part 3. This time we're going to look at lesions containing no melanin pigment at all. Here we have a lady and she has a lesion, a pink lesion, on the left thigh and on the right thigh. And here are the close-up images of these two lesions, and it is not possible to make a diagnosis, even a decision, based on these clinical lesions. The first thing we're looking at is the lesion on the left thigh, and we're asking ourselves whether we can recognize this as one of the 5 common benign lesions. And we can, because this lesion has the pattern recognition of a hemangioma, a clods-only pattern. There are some linear variants, but that is universal with very, very small hemangiomas. This is the unequivocal pattern of a hemangioma. We leave it. Now looking at the lesion on the right thigh, and we see if we can make a diagnosis of any of the 5 common benign lesions: nevus, seborrheic keratosis, hemangioma, dermatofibroma, or sebaceous gland hyperplasia. And we can't. Because it's non-pigmented, we will use the decision algorithm, prediction without pigment. So first of all, we look for ulceration, and there is no ulceration evident on this lesion. Then we look for white lines, and there are white lines. And these are the polarizing specific type of white lines, and so we make a decision to excise the lesion. And we look for clues to a specific diagnosis, and there are none. So here's the dermatopathology of this lesion. Superficial spreading, spitzoid melanoma, Breslow thickness 0.8 millimeters. Now we have a pink lesion on this man's shoulder, and we cannot make a pattern recognition diagnosis of any of the 5 common benign lesions. We put this non-pigmented lesion through the decision algorithm, prediction without pigment. The first thing we look for is ulceration, and it is present, so we make the decision to excise this lesion. And we look for specific clues to the diagnosis. And this lesion has ulceration, it has BCC stroma, and it has fine linear vessels, all consistent with a diagnosis of basal cell carcinoma. Here we have a red lesion on a man's cheek. We cannot diagnose this as a pattern recognition benign lesion, so being non-pigmented, we apply prediction without pigment, and we look for ulceration. We can't see ulceration. We look for white clues. There are no white lines, but there are keratin clues, and so we decide to excise this lesion. The clues to a specific diagnosis are surface, well, we can't see any surface keratin, but there are white circles, very definite white circles, and a white structureless area. So in this case, we ignore the serpentine vessels, and we make a diagnosis of squamous cell carcinoma, which is the correct histological diagnosis. Here we have a pink lesion on a man's forehead. We cannot diagnose this as a nevus, a seborrheic keratosis, a hemangioma, dermatofibroma, or sebaceous gland hyperplasia. So we put it through a decision algorithm, and in this case there is no melanin pigment, so we use prediction without pigment. There is no evident ulceration, there are no white lines, and there are no keratin clues. So now we have to use vessel pattern analysis. And there is no benign vessel pattern. There's not a clods-only pattern, there's not a centered pattern, there's not a sebaceous pattern, there's not a reticular pattern. So we make the decision to excise this lesion, and we look for clues to a specific diagnosis. And we see that there is BCC type stroma, and there are fine linear vessels. So we make this provisional diagnosis of basal cell carcinoma. When we get the histology back, this is actually a Merkel cell carcinoma. It doesn't matter that we predicted incorrectly, because we predicted generic malignancy and we excised the lesion, and the pathologist was able to give us the histological diagnosis. Here we have a pink lesion on a man's scalp. We cannot call this one of the 5 common benign lesions. We put this non-pigmented lesion through the the prediction without pigment decision algorithm, and is broadly ulcerated, so we make the decision to excise, and we look for clues to a specific diagnosis. In this case, it's ulcerated, it has fine linear vessels, and these would both point towards basal cell carcinoma. We excise the lesion, and the diagnosis comes back as a typical fibroxanthoma. Again, it did not matter that we predicted the wrong specific diagnosis, because the decision algorithm led us to the decision to excise the lesion. Now we're looking at this pink lesion O2 in the lower part of this photograph. And we cannot call this one of the 5 common benign lesions, so we put it through prediction without pigment. There is no ulceration, there are no white lines, and there are no keratin clues. So we look at the vessels, and there is no benign vessel pattern present. So we make the decision to excise the lesion, we look for clues to a specific diagnosis, and there are fine linear vessels. We make the provisional diagnosis of basal cell carcinoma, we excise the lesion, it is a nodular melanoma. Again, it did not matter that we made the incorrect provisional diagnosis, because we made the decision to excise the lesion based on prediction without pigment. Lesions without any pigment can be very difficult to distinguish one type of malignancy from another. In particular, totally non-pigmented melanoma can masquerade as a basal cell carcinoma. A raised melanoma will not have dot vessels, because dot vessels depend on an intact rete ridge and dermal papillae pattern, which you will not have in a raised or nodular melanoma. Here we have a pink lesion on a man's scalp. We cannot make a pattern recognition benign diagnosis, so we put it through prediction without pigment. There is no ulceration. There may be white lines, but there are no keratin clues, and there is no benign vessel pattern. So we make the decision to excise. We look for specific clues to a specific diagnosis, and we do have fine linear vessels. We make the prediction that this may be a basal cell carcinoma, or maybe we just don't know, but we have to excise it, and the diagnosis is T-cell lymphoma. Again, it did not matter that we predicted the wrong diagnosis, because we made the correct decision to excise, and the pathologist was able to tell us the specific diagnosis. Thank you very much.